Hey, good day. This is Dr. David Wade. I hope you're doing great. I wanted to reach out to you and talk to you a little bit about a concept of vitalism versus mechanism, because these two different terms will basically influence the way you make health decisions and how you choose to go about applying solutions towards any type of health problem that you have. I wanted to start out basically this morning just asking a couple of questions. So here we have the spine, the nerves of the body and the different organs. And what would happen if you cut this nerve to the heart? Or let's say you cut the nerve right here to the stomach. What would happen? That's right. The heart would stop or quit working, or the stomach would cease to function. Now, that's not 100% accurate in total, because the heart has an inner intelligent mechanism to be able to function and to keep itself beating even outside of the body. And that's really what I wanted to talk about relative to the concept of vitalism versus mechanism. Vitalism versus mechanism. Have you ever heard of the word vitality? What does that mean when somebody has vitality? It means they have a lot of energy and life inside of them. Well, that concept of vitality or vitalism really is basically that the summation of all these parts working together in harmony is greater than just the individual parts by themselves. Mechanism is a different concept. It's really more about how traditional medicine has focused in regards to individual organs and systems operate independently of one another, and that you influence them from the outside to be able to affect the functioning of the body. It's more like how a mechanic would relate to a car. We recently had a car that the fuel pump was gone bad, and so wasn't getting any fuel pressure. So we're having to replace the fuel pump. And by replacing the fuel pump, the car will get back operational, it'll crank up again, and we'll be able to drive it. Well, that's not exactly how it works with the body. The summation of all the parts in and by themselves are not what constitutes the entirety of who you are. The entirety of who you are really is a flow of energy from the brain to the body to the different organs that allows things to operate and to function. That's more of a vitalistic concept of health, and it really relates more towards what we see in chiropractic. The concept of healing that you need to really address and understand is really relative to your paradigm of whether you follow more of a vitalistic type of a paradigm or a mechanistic type of a paradigm. If you're a mechanistic type of paradigm person, you'll be more likely to take the pill for the problem. If you have a pain, you can take a pain pill or get a muscle relaxer if the muscles are in spasm. Whereas if you're more of a vitalistic type of a thinker, you'll recognize that taking a pain pill is not really addressing the true underlying cause of the problem, and it's really only covering up the symptoms. So it really has a lot to do with how you think is going to drive your behavior and your actions. So I just want you to start opening up your thought process and in understanding why you choose what you do, because it's going to make a big difference in your longevity and vitality. Chiropractically, we believe that the body heals from the inside out. Mechanistic thinking is something that heals from the outside in. So it's just food for thought. I want you to be thinking about these things, and I'll be bringing you more information and be asking you more questions, because I want to interconnect with you and understand exactly what your problems are so that we can address those things individually. All right, this is Dr. David Wade wishing you good health for a lifetime. Thank you.